Good morning to you all, and thank you for allowing us to be with you today and to share some of our work in the field of medical services for the poor in rural India. This presentation will focus on the desperate need for medical facilities and our response. The recently inaugurated Sri Satya Sai Sarla Memorial Hospital. This hospital was named after the world-renowned humanitarian Sri Satya Sai Baba and Sarla Shah, an incredible woman whose compassion, caring, and dedication to selflessly serving the poor and those in need is truly inspirational. This hospital is located in Mudanhalli, a small village in the Chikkabalapur district of Karnataka state in India. The project is part of a greater, more comprehensive global effort. This larger ecosystem of selfless service focuses on the fields of healthcare, nutrition, and education. This effort has been supported by local, state, and national governments, an international consortium of NGOs named the Sai Global Federation of Foundations, which Divine Will Foundation is a proud part of, other organizations such as Rotary International, a number of local, national, and international businesses, and many, many well-meaning individuals, including those living in the areas served. Now let's take a look at the global mission briefly. In the field of education, we have 23 campuses in India, along with schools in Nigeria, Laos, and Australia. In India, education is provided from 6th standard through doctoral studies. Online classes in general ed are provided freely to all who want them, and this allows those in rural areas who cannot attend school to still receive an education. To date, over 5,000 hours of educational material has been prepared, which has been accessed by over 18,000 different viewers for over 70,000 hours of viewing. We also provide specialized training to educators worldwide in values-based education. In the field of nutrition, over 500,000 school children are benefited by the efforts of our Annapurna breakfast program on a daily basis. Where cooking facilities are available, a hot, nutritious breakfast is provided. Where such facilities are not available, the students are provided with a specially formulated nutritional supplement mixed in milk. Now, this micro and macronutrient supplement is also provided to an additional 10,000 preschool children and 3,000 expectant mothers daily through our SciSure program. And it's anticipated that we will be supporting well over 1 million children by this time next year. In the arena of medical services, we have hospitals in Nigeria, Sri Lanka, Fiji, as well as medical clinics in India and the United States. And the one in the U.S. is located in Clarksdale, Mississippi. Additionally, in India, we have 3 super specialty hospitals focused on pediatric cardiology. Now, these hospitals have already provided open heart surgeries and cath interventions to close to 17,000 children, as well as providing 140,000 consultations and 97,000 screenings of expectant mothers and children in villages. We have a very vibrant medical outreach program in West Bengal that provides on-site medical care utilizing mobile hospital and fully equipped vans to the villages surrounding Calcutta, as well as to the city itself. All services in all fields are provided 100% free of cost to all recipients. Now, the effort we're going to focus on today is our most recent development of a new hospital. Initially, this was designed to be a 150-bed general and specialty hospital focusing on maternal, prenatal, obstetrics, and pediatric services. As you'll see, this project has morphed into much, much more. Now, India has a desperate need for rural health care. Close to 70% of India's population lives in her villages, yet 80% of all healthcare facilities, medical manpower, and support services such as labs and imaging services are concentrated in urban areas where only 30% of the population lives. Specialties such as obstetrics and gynecology are almost solely reserved to be found in the urban areas and larger towns. Emergency rooms are only found in the more populated areas. Despite having one of the largest medical school systems in the world, with an annual intake of over 50,000 students, very few doctors work in rural areas. Of the over 25,000 primary health care centers, called PHCs, which serve the rural areas, more than 8% of them don't even have one doctor. 38% don't have a lab or lab technician, and 22% don't have a pharmacy. Imaging services, even those as basic as x-rays, are rare, and emergency services are virtually non-existent. Now please consider this, and this information is from the Indian Journal of Public Health. When looked at as one integrated nation, the ratio of doctors in India to people is 1 to 921, which on the face of it is not too bad. It's pretty good, considering that the World Health Organization recommends one doctor for every 1,000 people. Even when you remove the non-allopathic doctors, such as homeopaths, Ayurvedic doctors, and the such, and I do value them, you're still at 1 to 1,400, which is not too bad. But when you look at services in rural areas, the picture is drastically different. As most of those living in rural areas cannot afford private health care, which is usually not available in those areas anyway, they primarily go to government doctors in government hospitals and PHCs, primarily the PHCs. These doctors account for only 5% of the total number of doctors in India. 5%. The numbers in Karnataka state are staggering. There's only one government doc for every 13,556 people. Overall in India, the ratio is only a bit better, with one government doctor serving a population of 11,082, which is still 11 times the minimum recommended by the World Health Organization. Understaffed and overworked, many of these highly qualified and experienced doctors leave government service for the more lucrative private sector. While some truly incredible docs remain, many government doctors are young, inexperienced, and in some cases poorly trained. While private medical care is available in larger towns and urban areas, the distance and high cost involved in this places it out of reach of most villagers. Lacking effective insurance, over 68% of healthcare costs in India are paid for out of pocket. This is while the world average is only 18%. And this is pushing many Indian families into poverty. In fact, over 60 million fall into poverty each year directly due to catastrophic healthcare expenses. This means that more than 6,800 people fall into poverty each and every hour. And this has been tremendously complicated by the recent situation. As you know, the pandemic has incredibly detrimentally affected the health of the people and has had a devastating impact on the economy. While India cut poverty sharply from 2011 to 2019 with a notable increase in the middle class, this trend was dramatically reversed in 2020. As COVID-19 has spread throughout India, it has pushed India's middle class closer and closer to poverty. In fact, India now leads the world in people falling below the poverty line since the pandemic began. By taking a look at the Chikkabalapur district, we get a graphic understanding of this untenable situation. With a population of close to 1.5 million people living in close to 250 villages and one urban center, this district has a total number of 55 government PHCs. Now this might almost seem adequate until you understand what the average PHC is like. They often lack a doctor, a surgeon, surgical facilities, emergency equipment of any type, and this includes something as simple as a defibrillator or even an AED. They lack imaging equipment, even basic X-ray technology, a laboratory, and even a pharmacy. These PHCs can only provide the most basic rudimentary care. Now, the emergence of telemedicine has helped somewhat, but even where it's available, care is hampered by the lack of medicine because there's no pharmacies, and the lack of medical supplies and treatment facilities. As was recently reported, India in general was overwhelmed by the need for oxygen during the COVID crisis. This was true in almost every urban area, but was even more desperate in the rural areas where oxygen supplies were almost non-existent. Now, I want to stress at this point that this is not due to the lack of efforts of many government officials. Many of them try, but cannot do anything on their own due to the lack of doctors, the lack of funding, and the lack of equipment. Maternal and prenatal care is very difficult to come by, and obstetric delivery services are generally found only in the larger urban areas. Now, this is usually not a problem unless there are birth complications. In those cases, it can be tragic. One state, Madhya Pradesh, reported that over 72,000 infants died due to the lack of adequate medical services in a recent 9-year period. One can only imagine those numbers for the entire country. To say that there's a lack of emergency services is an understatement, a tremendous understatement. Emergency rooms are rare except in the largest town and urban areas. And ambulances often don't have qualified paramedics in them and lack even the most basic equipment. Many don't even have oxygen. These ambulances are at best simply a means of transporting someone needing medical attention to the nearest hospital. And when you consider that in the rural areas, ambulances are often an hour away and transportation to an adequate medical facility can take 2 to 3 hours, you start to get an idea of the severity of this need. It has been reported that many villagers simply don't even seek medical attention anymore due to the lack of availability, the high cost, and other factors. They've given up hope. Now, as mentioned, there are medical schools, but they're so expensive that the graduates come out owing so much money, they're forced to work in urban areas to pay back that debt, even those who would prefer to serve in the rural areas. Additionally, it has been reported that many of these schools provide substandard education and substandard training to the point wherein the Union Health Ministry stepped in and barred 82 schools from taking any admissions in the 2018-2019 school year. During the pandemic, the lack of ICU beds and high dependency unit or HDU beds became sadly apparent. Now, these beds are needed to provide oxygen and patient monitoring. With a population in excess of over 1.5 million people, the entire Chikkabalapur district had less than 50 total combined ICU and HDU beds. And Chikkabalapur is considered one of the better prepared rural districts. Now, with the guidance of our spiritual teacher, Sadhguru Sri Madhusudan Sai, who follows Satya Sai Baba's teachings of love all, serve all, a massive effort was undertaken to build a hospital to begin to address this need. This was not to be simply a basic hospital, but was rather to be a beautiful structure that would effectively be a temple of healing. With a total of 8 wings, this state-of-the-art, multi-specialty hospital would have an in-house oxygen plant and would provide 3 modular operating theaters along with 125 HDU beds and 25 ICU beds. However, we needed to rethink that. We quickly realized that the idea of a total of 150 beds was impractical. Now, this hospital will provide 300 beds, all with oxygen and state-of-the-art monitoring equipment. 150 of these beds are already available. Supported by a full laboratory, a blood bank, a pharmacy, and serviced by a fully equipped ambulance service with paramedics, this 66,000 square foot structure will have a number of units. These include general medicine, general surgery, pediatrics, neonatology, ophthalmology, dental, an ICU, and also an emergency room. It will also feature specialties including endocrinology, neurology, gynecology, cardiology, nephrology, fetal medicine, and medical and surgical oncology. It houses a full imaging center completely equipped and an entire section devoted to mother-child health care, including obstetrics and delivery services, along with an infant ICU unit. This hospital will be fully staffed with all necessary doctors, specialists, nurses, paramedics, and support personnel. Due to the current pandemic, we're also preparing it to serve as COVID care center. It is already providing maternal, neonatal, and pediatric services as well as fetal health care. Also in operation is the obstetric gynecological unit and the infant ICU. Initially, it was difficult to put together a labor force due to the COVID crisis. However, in the few weeks prior to our scheduled inauguration, a team came together of over 200 primarily local workers who worked in 3 shifts round the clock. Now, if you take a look at this next slide, you'll see what happened between July 19th and the inauguration on the 24th of July, a period of only 5 days. The success of an effort like this is based on 3 factors, which are like an equilateral triangle with each side supporting the other. One leg is the government, one leg is charitable organizations, the third leg is the society, including individuals and businesses. The state government here has been very helpful. They provided support by clearing all of the necessary permissions and also helped to establish bus and train stops to help those needing transportation. Dr. K. Sudhakar, the State Minister of Health, Family Welfare, and Medical Education, has been working side by side with us since the inception of this project. On the 27th of July, Sri Basavaraj Bommai, the Chief Minister of the state of Karnataka, visited the hospital, and at that time he promised his government's full cooperation in each and every aspect of this expanding project. Businesses and charitable organizations contributed supplies, equipment, necessary consultation, as well as all required financial support. One example of how individuals supported this program happened one night late, very late, right before the inauguration. One worker was seen working long past his shift, and it was suggested to him that he take a break and come back in the morning. He simply refused. It seems that his father had been treated at one of our hospitals and his life had been saved. When he went to pay the bill, he was told that there was no bill, that all treatment was completely free of cost. Now, he said this was more than just payback. He believed that this hospital was a gift of God to the people of his area and his village, and he wanted to do everything he could do to help. This sentiment was echoed by many other workers. In fact, many of them refused any overtime pay. What they said was that they would accept pay for their regular shifts, but the overtime and extra work was their gift to this effort. Now, one thing our spiritual teacher has told us is that the reward for good work is more good work. Accordingly, on the 27th of July, we had a groundbreaking ceremony for the second phase of our effort, which is titled the Sri Satya Sai Rajeshwari Memorial Hospital. Now, this 3-story, 100,000 square foot facility will house additional operating theaters, more ICU and HDU beds, and will expand all facilities that were already mentioned. This hospital is named after one of the most brilliant, compassionate, and caring physicians in recent history. Dr. C. Rajeshwari was a professor of obstetrics and gynecology for over 25 years. Additionally, she had highly successful practices all over the world, including one at Stanford. Afterwards, she returned to serve India by establishing a free hospital in Whitefield, a suburb of Bangalore. She has left an incredible legacy in the field of rural healthcare in many ways. One way we directly benefit from. Dr. C. Rajeshwari's son, C. Srinivas, has been spearheading our work in the field of pediatric cardiology. He's the chairman of the Sri Satya Sai Health and Education Trust, which both builds and operates all of our child heart healthcare services. He also plays an instrumental role in establishing these hospitals worldwide. Both mother and son are my heroes. But we're not stopping with the second phase. Noting that the sheer cost of a medical education prevents many from serving in rural areas, we already have applied for and are in the process of getting approval for an absolutely free of cost medical school that will produce doctors, nurses, and paramedics, as well as provide existing doctors with training in specialty areas. That makes this complex not only a state-of-the-art medical facility, but also a multi-specialty training and teaching hospital. When completed, the entire medical campus will have a total of 7 modular operating theaters, over 40 ICU beds, over several hundred HDU beds, which will bring the total number of beds in the medical complex to 460. It will also have kitchen facilities to provide food to patients and staff, and will provide free housing to the medical staff. Quite honestly, I was stunned when given the timeline for this project. The medical school will open in August of 2022. Now, I was stunned, but I wasn't in disbelief. We had already seen what was possible when good government, caring businesses, dedicated people, and philanthropical institutions come together, working for a common cause. Sri Satya Sai Sarala Memorial Hospital has proven the concept. We know it can be done, and we will do it. We invite any of you who are interested in participating in any way to please contact us. And if you want more information about any of the work we do anywhere in the world, please feel free to drop me an email. The contact information is on the screen. And I'd also like to take this opportunity to thank all of you for all of the fine work you're already doing. And thank you for allowing us this time to talk to you about the work we're doing. Namaste.